struggling with swelling and lymphedema in your left leg, follow along with me in this video as I guide you through a complete lymphatic massage sequence for that left leg. Doing this lymphatic massage can help decrease your swelling and pain and help you walk and move better to do the things you love. I'm Dr. Alex Hill, your physical therapist for everything oncology and lymphedema. I'm a certified lymphedema therapist and I specialize in cancer rehab. Let's get that fluid out of there. Manual lymphatic drainage, or MLD, is used to help decrease the swelling from lymphedema, get that fluid out of that area that's swollen. Before you start a new program, including MLD, always check with your medical provider first. While you're doing MLD, if you feel short of breath, chest pain, dizziness, or something just doesn't quite feel right, stop immediately and you contact your medical provider. I'm going to be showing you the sequence for your left leg in a recliner, but if you don't have a recliner chair, you can also do it sitting in a comfortable chair or lying in bed. Regardless of where you have swelling and lymphedema, the starting point is always the same, at the belly. You'll start with your hands on your abdomen around the place of your belly button. Breathe in through your nose, pause, and then slowly breathe out through your mouth. As you breathe out, you're going to gently press into your abdomen. This helps to stimulate the central part of the lymphatic system, but if you have pain or you're not comfortable doing the abdominal pressure, simply doing the deep breathing is just as helpful. Next, we're going to do this in 4 other places. So you can see that my belly is divided into 4 quadrants, and we're going to do that abdominal pressure and breathing in each of those places. So we're going to place our hands at our right lower belly above the hip bone, breathe in through the nose, and breathe out through the mouth, give that little pressure. Breathe in, and we're going to press in at the right upper belly as you breathe out. Breathe in, we're going to the left upper belly, we're going to breathe in, and breathe out. Giving that little pressure. Last place, we're going to move down to the left lower belly, breathe in, and breathe out. Now that we've got the central part of the lymphatic system woken up, now we're going to move up to the neck. You're going to place one hand on the neck right behind the collarbone, and you're going to do circles going in. You can also do both at the same time, and we're going to do that 5 to 8 times. This is going to stimulate still the central part of the lymphatic system, but this is the last place that fluid goes to before it really gets back into the system. So because the lymph vessels are compromised in the left leg, we're going to move that fluid to the lymph node regions that are able to take up that fluid. That means we're going to move the fluid from the left leg up to the left armpit and over to the right groin. If you have swelling in the right leg, so you have swelling in both legs, you don't need to move it over to that right side. You only want to move that fluid from the left leg up to that left armpit. Go ahead and take your right hand, fingers together, place it at the left armpit. You're going to do slow circular movements at the armpit with your whole hand. Just like at the neck, we're going to do this at least 5 to 8 times. After that, we're going down to the right groin, right in that hip crease where the hip joins. Again, you're going to place flat hand, fingers together, right at the hip crease, and you're going to do, again, 5 to 8 circles. This is again starting to stimulate those lymph nodes in the areas that we want to move that lymphatic fluid from the left leg. The last place for the lymph nodes that we're going to stimulate is actually the left groin. So even if you had surgery with lymph nodes removed in that left side, or you had radiation or other problems with the lymph nodes there, we can still stimulate those lymph nodes to help get that fluid back into the system. So fingers together, hand flat, you're going to place it at that left groin, and you're going to do those 5 to 8 circles right at the left groin. All right, now that we've got those lymph nodes all stimulated, now we're going to start moving that fluid. Again, we're going to be moving up the left side and over to the right groin if you don't have swelling in that right leg. You're going to take your hand, fingers together, you see the theme here. You're going to place your hand at your left lower belly on the side, and you're going to slowly and gently start to pump your hand up the side all the way to the armpit. As you do this, you want to do slow and smooth movements, moving all the way up to the left armpit. And the best way to do this is skin on skin versus over clothes like I'm doing. That's going to give you the best results. It's going to really get those tissues and that fluid moving better. So although I'm doing it with my clothes on in this video, if you're at home, please do this without any clothes. Make sure you're doing it skin on skin. We're doing that 5 to 8 times. And as you move up, you'll see that I'm really trying to get around as far as I can on the side of the trunk, and I'm moving it directly up towards the armpit. You don't want to be moving it in towards the belly or the chest because that fluid's just going to move there. So we want to make sure that we're moving it all the way up to the armpit. So let's do that 2 more times. Good, this is starting to move that fluid. This should be lighter pressure than what we were doing to massage the lymph nodes. These vessels are just right underneath the skin. All right, 1 more time, really get that fluid moving. All right, so now we're going to move the fluid from the left groin over to the right groin. So fingers together, hands flat, moving from the left groin, you're just going to pump across to the right groin. Again, I'm doing it over my clothes. This is best done skin on skin. You can also kind of pull it across if that feels more comfortable for you. But either way, we're doing those nice slow pumps over from the left groin to the right groin. It should feel like you're right above the pubic bone. You don't want to be too high with this one. You're helping to move that fluid over. Good, let's go ahead and do 2 more, moving that fluid across. So now that we've opened up those highways, we've opened up those channels for that fluid to move from the left leg over to those other areas, now we can start actually working on the leg. You can see that I've got some arrows on my leg. These are really to help guide you as I move my hands. Sometimes it can be a little confusing, but the biggest thing is remembering that we're moving the fluid up towards the groin. So all of your movements should be there. Again, how you move your hands is how that fluid is going to move. So we're going to start on the leg. We're going to move our way from the top of the leg, so the thigh, and then the knee, and then the lower leg, and then finally the ankle, foot, and toes. So we want to move from top to bottom because if you think about the lymphatic system like a highway system, the cars at the bottom can't get off the highway until all the cars in front of it get out of the way. So that's how we go from top to bottom, and then we're going to work our way back up. The first place that we're going to massage at the leg is going to be our glutes. So if you can shift over so that the left side of your glute is up towards the ceiling, and you're going to massage and sweep the fluid as far back as you can reach and move that forward. We're going to do this 5 to 8 times, and you want to make sure again that your fingers are closed, your hands are getting full contact on the skin, and it's not over the clothes. For best results, you really want to do this skin on skin. So you're sweeping that forward towards the groin 5 to 8 times. If it's hard for you to do that and to actually move your body like that, then just reaching as far back as you can is still going to be helpful. You still want to move it from the glute and bring it up towards the groin. So we'll do that a couple more times, moving that fluid from the back to the front where it can get back into the system at those lymph nodes in the groin. We'll do that 2 more times, sweeping it forward. Got one more time. You can spend extra time here if you do have more swelling at the glute. So now that we've moved from the glute forward to the groin, now we're going to start on the thigh. So taking your hands, fingers closed, flat on the skin, you want to make sure you have that full contact. You're going to massage up the leg, and you're going to go basically from the knee all the way up to the groin that you just opened up those lymph nodes at. You're going to repeat this 5 to 8 times. However, if you do have more swelling in this area, if you have fibrosis, which is a firmness, a toughness to that skin and tissue because you have chronic swelling and lymphedema, then you can certainly spend extra time here. You can also do some deeper kind of kneading work to the areas that are a little bit firmer, and then finish up with that lighter massage. Okay, so we're going to do that one more time, really moving that fluid up. Again, pause the video if you need to spend extra time here if you need to. So after we finish the top of the thigh, I'm going to work on the back and the sides of the thigh. So I'm going to lift my leg up a little bit so you can see here a little bit better. You're overlapping or one right on top of the other, and you're bringing it forward. So you're going to do that. Repeat 5 to 8 times. You're going to bring that forward and up, forward and up, forward and up. So just like with the front of the thigh, if you have extra swelling on the inside of your thigh or right above the knee, then you can certainly pause the video, spend extra time here. But again, we're just doing this nice and slow, easy movements, and we're just massaging that fluid up and forward, bringing it to the front of the thigh to help get it back into the circulatory system at those lymph nodes. Just like with the front of the thigh, if you have extra firmness or fibrosis, you can do kind of a kneading technique at the inner part of the thigh if you need to, and then always finish with that light massage. Okay, so we'll do this one more time for the back and the sides. And then after we finish the thigh, we're going to move down to the knee. So since your knee is already bent from working on the back, we're just going to go ahead and massage the back of the knee. The movement is going to be like you're coaxing it or bringing it forward. You can give a little bit more firm pressure to this area because there are lymph nodes that sit at the back of the knee. So we're going to massage that 5 to 8 times. If it feels good, if you have extra swelling here at the knee, pause the video, spend extra time here. That 5 to 8 times is just a minimum amount. I often will spend 10-15 minutes at just one particular area for somebody if they have extra swelling there. Next, we're going to go up the sides of the knee. So we're going to be bringing it up and forward. Again, 5 to 8 times. Spend extra time if you need to. All right. And especially if fluid tends to pocket right here on the inside of the knee, spend extra time there. After 5 to 8 times at the side of the knee, then we're going to do the top of the knee. I usually just like to use one hand for this one, but you can certainly use 2. So that's, again, 5 to 8 times, moving that fluid up the knee. And then after we finish at the knee, then we can finally get to the lower leg. So if you're in a chair, then you can either cross your leg over to do this massage. If you're in bed, then you'll just need to bring your leg up towards you. If you're in a recliner, you can always use a pillow to help support your leg, or just move the chair for however you need to get it to be comfortable for you to be able to reach your leg. So what we're going to do for the lower leg is we're going to, just like with the thigh, we're going to sweep it up to the knee. So you're basically going from the ankle to the knee. We're doing that 5 to 8 times. If you can, you want to keep your leg elevated or flat. That's going to help with using gravity to assist with getting that fluid up out of the leg. So that's ideal. Again, if you can keep it elevated or at least flat, that's going to be really helpful for you. But again, do what you can just to be able to reach. Just because it's a little challenging to be able to reach all of these places. So just do what feels comfortable for you. Play around with using pillows or different supports that can help you keep that leg elevated and comfortable and pain-free. All right, so let's do that one more time. Coming up the leg. Again, you can spend extra time down here if you have more swelling at that lower leg. No problem doing that. All right, so now the back of the calf, we're bringing it up and forward, just like with the thigh. So you can do one hand at a time like this, bringing it forward. Again, you see those arrows that you're following up. Bringing it up and forward. Or you can do both at the same time, but you want to make sure that you don't have any gaps as you're bringing that up and forward. So whatever feels most comfortable for you. I think rhythm-wise, it just kind of feels a little bit better to do one at a time. You're going to get a little bit of overlap as you bring that fluid up and forward with doing it like that. All right, so let's do that 2 more times. Really get that fluid moving. Again, if you have it crossed, it's going to look more like this, helping to bring it up. All right. And then we get to the ankles. So again, if you're sitting, you can always have it bent up like this if that's hard for you to reach. Just move your recliner or your support so that you can better reach the ankle. And so when we do the ankle, you're cupping your hands and you're moving it up the ankle, just like we did at the knee. So we're sweeping it up. So we're gonna do that 5 to 8 times, but again, spend extra time if you need it down here. A lot of people have swollen ankles. So if you have puffy ankles, you have swollen ankles, you wanna make sure that you're spending extra time here. Again, if you can, try to keep that leg elevated as you massage the ankle. That's just gonna help with moving that fluid up. And then after we finish the ankle, then we are finally at the foot. For the foot, you're going to just sweep it up like this. Again, 5 to 8 times. Spend extra time if you have more puffiness at the foot. And then after we finish the foot, then we go to the toes. You can either do just a general sweeping coming up, or if you have extra puffiness at your toes, I want you to actually work each one individually. So you're gonna basically be going like this at your toes. So you can spend extra time at each toe if you have swelling at your toes. If you don't have any swelling at your toes, then you can just do just the general sweeping up. Or if it's hard for you to get each toe individually, if it's hard for you to move your hands like that, then just doing the general sweeping will be just as helpful. Okay, so again, 5 to 8 times for each toe. All right. You know the old rhyme, this little piggy went to market. These little piggies got some lymphedema treatment today, right? We want to give them a little TLC. So after we do that 5 to 8 times at the toes, we're not done. Now we need to go all the way back up the leg. So instead of doing it 5 to 8 times though, we just need to do 2 to 3 times back up. So we do 2 to 3 times at the toes, 2 to 3 times at the foot, 2 to 3 times at the ankle, 2 to 3 times coming up the calf, moving that fluid up, and then moving it up the shin, 2 to 3 times. And then we've got the knee, so we have the front here, we've got the sides, we've got the back of the knee. Remember, we're moving it forward. We're bringing it towards us. We've got the back of the thigh. Remember, we're sweeping that from the back, bringing it forward. And then we're doing the front of the thigh, bringing it up to the groin. All right, and then last place on the leg, we're gonna shift over if you can. We're gonna bring that fluid from the glute, bring that all the way forward to the groin. And then we're going to repeat moving the fluid over from the left groin to the right groin. Again, you can do that 2-3 times, bringing it over, again, skin on skin. And then we're gonna move up the side of the trunk here. Wanna make sure you're reaching as far back as you can and moving it up to the armpit. Okay. And then after that, the very last thing we're going to do is finish with some breathing. So go ahead and put your hands on your belly, breathe in through the nose, breathe out through the mouth. A little bit of pressure as you breathe out, breathe in. Breathe out through the mouth, a little bit of pressure. All right, excellent job. Excellent job doing that manual lymphatic drainage for your left leg. I hope that you're feeling better after doing it. A little side note, if you find that you're having to go to the bathroom more often and have to pee more, totally normal after you do MLD. You're getting that fluid out of the leg back into the circulatory system, and some of it you gotta pee out. You can do manual lymphatic drainage once or twice a day and try to do it at a time of day that's convenient for you, that will be the most likely that you'll be able to do it consistently. Most people do the MLD in the evenings once their day is slowed down a little bit. I hope this full routine for manual lymphatic drainage for your left leg was helpful for you. Thanks for watching, and make sure to subscribe, turn on those notifications for more videos on managing your lymphedema.